Hi there, my name is Leah and I'm a geriatric care manager with Givers Health. Thank you for joining me. As caregivers, when we help our loved ones navigate healthcare, it can often be confusing. Sometimes the services that are set up for our loved ones have very similar names, and it can be confusing to know exactly what kind of service they're providing for our loved ones. So in this video, I'm going to help you decode what some of those mean. I'm going to start out with the most confusing one, the difference between home health care and home care. I'd like for you to think of home health care as short-term temporary care. Most oftentimes, our loved ones are ordered this by a physician after a hospitalization or maybe a procedure or surgery. And the services performed by home health care are done by licensed professionals like nurses, physical therapists, occupational therapists, and speech therapists. They can receive therapy to help them increase their strength and mobility. They can also do wound care, or if there are other complicated medications, or they want to keep track of blood pressures, things in that nature. But the key thing to remember is that this is short-term and temporary. It's usually just for a couple of weeks, and you can expect a handful of visits a week, maybe once by a nurse and once or twice by the therapy components. Now, talking about home care, this is services often done by non-licensed professionals. So you can think of them as being an aide or a companion. And the services that are performed by these groups have a much bigger array than home health care. This could be personal care with helping your loved one bathe, get dressed, transportation to doctor's appointments, but they can also do some light housekeeping, run errands, meal preparations, and a whole bunch of other services. Typically, these services are set up on a private pay basis. However, some insurances as well as veterans benefits may help foot the cost for home care services. Home care services can be just a couple hours a week or a month, all the way up to 24 hours a day live-in care. It's really something that you establish on your own with an agency or an individual that you hire privately. Next up, I'm going to discuss the difference between short-term rehab or skilled nursing versus long-term care. And this one can be confusing because they're most often done within the same building. So starting with short-term rehab and skilled nursing, they're essentially the same thing. What this is often done is when our loved one has a hospitalization and they're not quite strong enough or ready to go home, and they need 24-hour nursing care. So in this short-term rehab, our loved one will be provided with 24-hour nursing, as well as physical, occupational, and potentially speech therapy to help them get back to their original strength and mobility. You can expect this to last anywhere from a couple days all the way up to 100 days. And depending on your loved one's insurance, this may be paid in full, or they may end up enduring a copay based after a certain number of days. Long-term care is a little bit different. While it's still in the same building, this is what we sometimes call a nursing home, or what our parents or grandparents used to call convalescent home back in the day. Essentially, this community becomes that patient's home. And in order for them to stay safe, they need 24-hour nursing care. So there's nurses, CNAs, dietary team, social services team, activities team, all working together to make sure that those patients are safe and living a good life in this community. Oftentimes, these services can be private pay, or depending on their finances, could be covered by Medicaid, and some do have long-term care insurance that'll help pay for this as well. The next differences I'm going to talk to you about are the difference between family medicine, internal medicine, and geriatric medicine. Now, family medicine are physicians who specialize in basically the whole range of life. Some start seeing patients as early as babies or toddlers, and they go all the way through elderly and end-of-life care. An internal medicine doctor will start seeing patients at the age of 18 or 21, depending on what they're most comfortable with. They're specialized in adult care only, rather than the full spectrum like a family medicine doctor. Geriatric medicine or a geriatrician, they may be hard to find in your area. However, these are physicians that are specialized in senior healthcare. Typically, these individuals will start seeing patients around the age of 60 or 65 and will stay with them through end of life. Lastly, I'm going to discuss the differences between palliative care and hospice care. Hospice care is generally known as end-of-life care. These specialized individuals help patients and their families through the death and dying process. And this could be anywhere from a few days to 6 months before someone is expected to pass away. There is so much good that comes from working with a hospice team in your loved one's end of life, and not just for the patient. They're really there to help serve the whole family. With nurses, doctors, aides, as well as social workers and counselors, your whole family can help prepare and start the grieving process together. Now, what makes these two so confusing is that both palliative care and hospice care are provided by the same organizations most of the time. But what makes palliative care different is that this focuses on serious illnesses or chronic condition and helping a patient and their family manage it to live their best life. It actually has nothing to do with end-of-life care, but actually making life better much before then. The team is very similar with hospice, as this individual will have a physician, nursing team, access to social workers and counselors, but the services are intended on making their life better, coordinating care, and still helping to treat that serious illness or chronic condition.